Broadcast is now starting. All attendees are in listen-only mode.
All right, good morning / afternoon, depending on where you're joining us from. Welcome to today's webinar. We are very excited to get started here, and we have a lot of interest and a lot of participants joining us here today. So we're going to be starting on time at noon Central, so that's about 4 minutes or so out based on our clock. So we're gonna let folks roll in, but sit tight. Just wanted to let you know you're in the right place, let you see our lovely panelists here. And we will be with you very shortly, so sit tight. Well, during normal webinars, I give updates every time about 50 people or sort of 30 people log in, just to let them know they're in the right place. But considering the fact that we had over 4,200 people register for this webinar, that 50 people are signing in about every 2 seconds right now. So just letting everyone know you are in the right place. We're going to be getting started in about 3 minutes. Sit tight, and we'll be with you soon. We're going to let folks roll in. We've got a max here of 3,000 people who can attend, and we do anticipate having a full house. So sit tight, and we're excited to get started at the top of the hour. Okay, hundreds more rolling in here. Again, for the folks who are hearing this reminder over and over, sorry, but we're letting people know that they're in the right place. You're not supposed to be hearing anything right now. We're going to be getting started at the top of the hour. We just opened the room up. Wanted to give you, just let you know that you're in the right place. So sit tight. We have, about a minute and a half or so before we'll start. We will get started on time. We're just letting folks roll in here. So sit tight. We'll be with you soon. Okay, we're just about to get started here. Many more people rolling in. Seen some questions about whether or not you're supposed to hear anything. We have not started yet. We will be starting at the top of the hour, which is mere seconds away. So sit tight, and we'll be kicking off just a few here. Okay, well, it is noon Central by my clock, so I want to respect everyone's time, and so I do want us to start on time here. We have a lot of great content to go through today, and I know that everyone's interested in hearing from our wonderful speakers. So let me be the first to welcome you to today's webinar titled How to Reopen K-12 Schools in the Safest Way Possible, A Path Forward for Education on COVID-19. My name is Brooks Ballard, and I'm the Vice President of Communications and Technology at Catch Global Foundation, and I'll be your moderator today. We're excited to have a great set of speakers with us, and I'd like to start by introducing them and their organizations. First, this webinar is being hosted by the Michael and Susan Dell Center for Healthy Living at the University of Texas Health Science Center at Houston, UTHealth, School of Public Health. The Center for Healthy Living was founded in 2006 with a vision of healthy children in a healthy world and a mission to advance health and healthy living for children and families through cutting-edge research, innovative community-based programs, and dissemination of evidence-based practices. You can see all of their great work in public health at msdcenter.org. From the Michael and Susan Dell Center for Healthy Living, we have Dr. Steve Kelder and Srila Sharma. Dr. Steve Kelder is a professor of epidemiology at UTHealth with more than 25 years of experience in design and evaluation of child and adolescent research, particularly interventions directed towards youth, schools, and parents. Recently, his emphasis is on interventions designed for promotion of physical activity and healthy eating, obesity prevention, and e-cigarette use prevention. Dr. Kelder was on the 2012 Institutes of Medicine Committee on Accelerating Progress in Obesity Prevention and also served as the senior scientific editor of the 2016 Surgeon General's report on e-cigarette use among youth and young adults, which declared the issue of youth vaping an epidemic and major public health concern. Dr. Kelder is also one of the lead investigators for CATCH and a founding board member of CATCH Global Foundation. Dr. Srila Sharma is a professor of epidemiology and co-director of the dietetic internship program at UTHealth and is a trained dietitian and physical therapist. Her interest is in nutrition and physical activity-based interventions to address obesity via school, family, and the community, predominantly in low-income minority populations. She co-founded Brighter Bites, a partner program of the Houston Food Bank, and serves on the Mayor of Houston's Go Healthy Houston Task Force. Welcome, UTHealth team. Next, I'd like to introduce Vandana Nayak and Angela Whitaker-Williams from Perkins Will. Perkins Will is an interdisciplinary research-based firm founded on the belief that design has the power to transform lives and enhance communities. They are consistently ranked as a top design firm due to their innovation research, design tools, and expertise. Social responsibility is a fundamental aspect of their culture, and every year they donate 1% of their design services to pro bono initiatives. In uncertain times such as these, they believe their interdisciplinary thinking can help their clients find solutions. Their thought leaders have been hearing and thinking about a variety of different ways to return to work, live, learn, heal, and play, and they'd like to share them with you. Based in the Dallas studio of Perkins & Will, Vandana Nayak is the regional education practice leader for Texas and works with clients across the state to deliver the next level of excellence in K-12 and higher education architecture and design. Her strategic thinking with her design insights make her a knowledgeable resource for clients and a strong leader at Perkins & Will. Vandana has experience of over 20 years and has led more than $1 billion in construction value in the education market, giving her a great understanding of the most critical issues related to schools, colleges, and university facilities. Her current clients include, but are not limited to, Northwest ISD, Melissa ISD, Plano ISD, Richardson ISD, Dallas ISD, Houston ISD, Collin College, Dallas College, Tarrant College, Texas Tech, the University of Texas at Dallas, Texas A&M University, SMU, and Monterey Tech. So all of them. Okay. Angela Whitaker-Williams has a bachelor's of environmental design from Texas A&M and a master's of architecture from Tulane University. She's been designing and planning K-12 schools for over 28 years and brings a depth of leadership to the Austin Perkins & Will studio. Angela believes great design is about people, relationships, context, and experience. She enjoys learning about her clients' drivers and implementing a flexible, timeless design framework that maximizes the programmatic opportunities, positively impacts the community, and creates amazing learning spaces. She's passionate about the education, the overall well-being of students. She volunteers her time mentoring in schools and as an advocate for special needs students. Welcome, Perkins & Will team. And the final speaker today is my colleague, Shana Green at CATCH Global Foundation. CATCH Global Foundation was founded in 2014, and our mission is to improve children's health worldwide by developing, disseminating, and sustaining the CATCH platform in collaboration with researchers at UTHealth. The foundation links underserved schools and communities to the resources necessary to create and sustain healthy change for future generations. Learn more about our work and programs at catchinfo.org. Shana Green is the CATCH Implementation Manager for CATCH Global Foundation. She assists school districts and after-school programs with the implementation of the CATCH curriculum and philosophies. Before joining our team, Shana was a cheer coach and physical education coordinator at Del Valley Independent School District in Austin, Texas. As the CATCH champion, Shana helped to transform the entire Del Valley Middle School campus into a model of healthy behaviors, events, and practices. Shana is recognized as an excellent Catch PE implementation trainer because of her knowledge and experience gained from working in after-school programs, all grade levels of public school, and years of experience providing trainings around the US. So welcome, Shana and the Catch team. So we have an excellent slate of speakers today, and before I hand things over to them, let me cover a couple of basic housekeeping items. As with all of our webinars, we want to encourage attendees to ask questions of our panelists and take advantage of the live aspect of the webcast format. You can submit questions via the control panel on your screen at any time, but to keep things moving, we're going to hold off on answering those until the Q&A portion of the webcast after the presentations. Keep in mind, we do have thousands of people attending today's webcast. If we don't get to your question, we will do our best to follow up with you and answer your question offline at a later time. So just please keep in mind and bear with us as we try to cull through the questions. If you have technical issues or problems, you can type those into the question box as well, and we'll do our best to help you out. I will go ahead and answer the most common question and tell you that today's webinar will be recorded and archived on the MSD Center website, along with a PDF of the presentation slides. All registrants will receive a link to that resource via email, and it'll be shared across our many social media accounts and web platforms as well. I'll be back to moderate the Q&A session at the end of the webinar, and now I'll hand things off to our first speaker, Dr. Steve Kelder. Dr. Kelder.
Great, thank you, Brooks, and welcome all of you all over the country. I appreciate you attending this webinar, and I want to start with a personal perspective. If you could forward it, please. I'm one slide behind. Oh, I see. Sorry, a little glitch here. So I'm not seeing it on my screen. I see it on yours. So go back one slide. So I just want to start with a personal perspective from my own thoughts before we begin the formal part of the webinar. And here you see that racial disparities are nothing new to the United States. They've been in existence for a long time. And when you add the COVID pandemic on top of that, we're putting a lot of stress on kids, on their families, on actually virtually everyone. So kids are experiencing this without their normal social supports and normal social systems like their friends or their school or their church and sports and their routines. Kids need routines to feel comfortable and good, and we have anything but routines now. So as we contemplate opening our schools, when and how, let's just keep in mind not just the academic portion of what they're doing, but the whole child perspective from a mental health and emotional and physical and well-being perspective. So next, please. So let's jump right in. So I thought it would be a good idea to just cover the difference between SARS-CoV-2 and COVID-19 corona disease. So here you see a picture of SARS-CoV-2, which of course is the virus. And COVID-19 is the result of the virus. It's the pathology, it's the sickness that occurs when when SARS-CoV-2 enters your body and enters your cells. Next, please. So here we see a balancing act that schools have in relation to the decision of deciding what to open, when to open. And you see there's public pressure. There's a fair bit of pressure to open schools. And there's also pressure to maintain the safety of students and staff and families. So it's a juggling act that is tricky. So schools some of them are opening this summer for summer school, yet not all the evidence is in place to feel 100% confident about your opening. So science cannot ensure 100% protection, at least not yet. What science can do is offer risk reduction strategies. So here we have my little representation of a person at a school trying to figure this all out. So don't feel alone. There's many resources which are accumulating, but they did not exist a month ago. So what's important is keeping up with what's going on. And part of this talk is for me to tell you where to find resources, as well as to spend some time sharing what I know already. Next, please. So I had a conversation with my friend Eduardo Sanchez. He's the former health director for Texas and is at American Heart Association now. And he shared with me a rubric that he uses in trying to understand COVID and how to categorize what to think about. And of course, the first thing is the rule of law. I imagine your superintendents and principals, at least in Texas, are in close contact with the commissioner of health. And so new rules, new laws are coming out on a regular basis. It's unfolding. For parents and others, if you visit the education website for your state, and our state is the Texas Education, you can find executive orders and proclamations for the federal, state, and county levels. It's important to learn these and understand them. It's really important for schools, but I assume you're already doing that. Next. So next is the rule of science. It's best if you let science help you make decisions rather than emotion or pressures. So the science is incomplete, I will say, to again say with certainty, but there's a lot that has accumulated. And one of the pieces that needs to be known is that watching the 7 to 14 moving average in reductions in deaths per 1,000 or 100,000 per day is important. It's also important to look, and this is a caveat, with appropriate testing, the level of new cases. So we're going to talk about that. I'll show you some figures and let you know how to figure that out. But most of the guidance on just entering in the decision and deciding to reopen schools is based on understanding these numbers, both nationally, statewide, and at your county level. So that's a pretty big thing to understand. Next. Thirdly, there's the rule of place. And of course, we all know about this, but, and I'm sure you've heard about super spreaders and super spreading environments. So with super spreaders, those are people that for reasons that are not quite fully understood, end up spraying the disease more so than others that also have COVID. What's important is that when one of those people are known, that you get them into, if they have symptoms, screening, testing, and then contact tracing, meaning that you follow the people that they've been in contact with, especially people at your school or at your campus. If it's an instructor, what other instructors has that person been with, or an administrator? And same with the students too. So that's kind of a daunting challenge. We'll talk about that. And then your physical distancing should keep people within a safe distance from each other. People that are found on campus that have COVID, if they're tested and they're actually on campus, should be put into some quarantine area. So your nurse or counselors or other areas should have a place at school. And then they shouldn't be let back on campus until there's confirmation of recovery from a physician. Super spreading environments are probably what you're already planning for. So how exactly are you going to do that? Look at the high density areas, the high contact, high traffic. And then schools and workplaces, pass objects, folders, balls, pens, toys, sport equipment, etc. You want to minimize that as much as possible, especially if you're in a region or county where you have a high rate of COVID. Next. So next is the rule of people. So we're asking people to do things that they don't normally do, like wear a mask and be socially distant from each other. And that's kind of tricky. So here's a few things to consider about that. But imagine a kindergarten class and kids hugging each other all the time. So how do you stop them from doing that? How do you have people remember to put their masks on and being distant and such? And then stay on top of their own symptoms or measure with a thermometer every day. So that's going to take practice and training and a discipline to monitor that the things that are being put in place are actually happening. Next, please. So fourth is the rule of policy. So what I mean by policy is control measures to oversee all of what I've just said. So procedures, policies, protocols. So what exactly should the school do if a kid has symptoms and you find out on the bus and the parent has already left? Or what do you do if there is a case on campus that's discovered on campus? What exactly will you do? So those are written documents. Not all situations have been defined, and not all situations have written rules, and which is why it's important to check in on a regular basis to the websites, or attend webinars maybe like this or others. And as more and more protocols are being developed, and hopefully they're being shared, and then we'll be able to actually test them come this summer and in the fall. Next. So here's the websites that I visit every single day. So I suggest that I offer to you to bookmark these. These slides will be available and on the Michael and Susan Dell Center website, so you can just go and get them. Of course, follow the TEA. CDC has a lot to offer about considerations for schools, mass gatherings, preschool, and so on. They also have city, state, and territorial department websites. So if you don't know who to talk to, if you don't know who your state health department person is, or your county or city, you can find out who they are and get the phone directory at these websites. Next, CDC has cases and deaths by county, which is very interesting if you want to know whether you're a high risk, medium risk, or low risk county. And then Johns Hopkins offers a lot of excellent information. Speaking of Johns Hopkins, this just went up the other day. They have training, and I'm going to suggest that all the teachers and administrators go through these training modules so that you're all starting at the same place with a common understanding of what to do and how to do it and why it should be done. It takes a little while to get through them, but it's not impossible, and it's not too far that you need to be a trained biologist to understand these things. Johns Hopkins has done a fantastic job, so I suggest you do that. And it might be a good idea, after you've viewed it, whether you think your parents should try and watch these things too, so that everybody involved has a common understanding of why it's important to be adhering to these rules and protocols. Next. So here we see the rates of positive tests in Texas on June 1st, 2020. And it's also from the Johns Hopkins University, but you can see the number of tests per day, the number of people who are, excuse me, I gotta put my glasses on so I can see it. The number of tests per day, the number of positive tests per day, or no, I'm sorry, the blue line is the 7-day moving average, and then the darkish columns at the bottom are those who are testing positive. So there's some rubrics now about what to expect, and for a state the size of Texas, 29 million people, it's estimated that 51,000 tests per day should take place before you can feel confident about the percent for your state. So right now the actual is at 18,000, or at least on June 1st. But a few days ago it was poking up over 40,000. So I don't know the explanation for why it goes up and down. However, it's recommended to have a solid estimate. You need to increase the amount of testing. And there's also the number of people who are testing positive on a daily basis. So 207 to 500 positive cases is where we want to be to consider our state at low or lower risk. And we're currently at 593, which isn't too bad. But when we look at Texas with 29 million people and spread out all over the state, there's a lot of hot box areas. For example, Houston, San Antonio, and Dallas, and other urban areas have a much higher rate than some of the others. So understanding your county level numbers is important. Next. So I just talked about the number of people who test positive. Here, we're seeing the number of people who die from COVID. And I like this website, which is the UT Austin COVID Consortium modeling, because if you look on the far right-hand side, the blue line, that's an estimate. So they're estimating into the future 14 days based on the algorithms that they've got from all the inputs that they get about what's going on in Texas. So this is the death rate. Death, of course, is different than being positive. So a lot of people are asymptomatic. So it's tricky, as I said, to get the right number of tests so that you feel good about the percent positive in the state. So, but deaths are deaths. And early on, the recording of the right underlying symptoms of death was a little bit spotty at the beginning of the epidemic. But these days, you can be pretty confident that that's a COVID death on that blue line. If anything, there might be a few more, but generally the trend is looking favorable, just like the trend before was looking favorable for Texas too. Next. What I like about this website is you can go by regions too. So here's San Antonio, New Braunfels area. You see that they do have a flat or slightly declining rate of death. So that's an indicator that things are getting better, or at least staying flat at a reasonably low rate. So you can find it at this website, which again is in the presentations for you to look at your own county. Next. So here's something from the CDC that I like quite a bit, and it's a visual representation. So it's cases of deaths, cases and deaths by county. So remember the two previous websites, one was for cases, one was for deaths. So here you can see both of them. You can see it by county, and it lists it in this case, it's the number of cases that is shown on the map. And if you just toggle it with a drawdown a box, you can look at the number of deaths and look at it by county. And the gray areas that you see there are counties which have a very low rate of cases. And if you confirm those cases against the number of deaths in the county and is very low or near zero, then you can feel more confident in letting open the schools and that you're doing the right thing. If it's maroon or purple, I would say Aggie colors, that's not so good. You have to make sure that all these protocols are being deployed properly and monitored properly. So this information can let you know your degree of confidence in opening up and that it's either safer or less safe. Next. So now I want to introduce you to my colleague, Shrila Sharma, who's going to talk about an app, COVID-19 symptom tracking, and she'll tell you why that's important. So I'll hand it to you, Shrila, to explain.
Thanks, Steve, and thanks for setting the stage up really nicely. I think something that Dr. Kelder alluded to a few minutes ago that's critical is that this is a novel virus, which means we are learning new things every day. And given the novelty of the virus, the speed of the pandemic, and how fast it spreads and the short time between exposure, symptoms, and clinical outcomes, it's really important that we get ahead of the spread of COVID-19. We are short of a vaccine or a treatment right now, so what's really keeping us safe are the social distancing and the mitigation strategies. So what I'm going to share with you for the next few minutes is how do we get ahead of the curve in terms of tracking COVID-19 symptoms. We have a lot of literature now that has told us a significant amount regarding COVID-19 symptoms and what they are. And since we have that information, why not use it to track the symptoms? Because tracking the symptoms can help us predict COVID activity and identify hotspots of the symptoms. And so we have an app for that. But before I share with you any information about the app, I wanted to show you what some of the results of the app have been. Next slide, please.
And just try to interrupt, Shrila, but just to jump in for our attendees here on the webinar, there is a slight delay between when we advance the slides and when it propagates out. We think this is just due to the fact that there's about 3,000 people attending live. So just to give you a heads up, we are aware that delay is there. Our presenters are also seeing that, so that's why it's a little behind for them. We're doing our best to anticipate, but appreciate your patience and thanks for letting us know. Go ahead, Srila.
Sure, next slide. Okay, thank you. So before I talk about the app, I wanted to show everyone some data, and this paper was published in Science just a few weeks ago on why symptom tracking is important. And so this app that I will share with you guys in just a couple of minutes was used and it has been disseminated to about 4 million people now, and this is the data that came out of the app. And so to the left, you see a figure on all participants who use the app who reported any COVID-related symptoms. And then to the right, you have two bar graphs, and those, the top one is those who tested positive, and the bottom is those who tested negative. And what is really important is the accuracy, right? I mean, without accuracy of prediction, any technology, as good as it may be, is useless. And so what the analysis showed is that participants with COVID symptoms, the app predicted 5 to 7 days ahead of time the COVID positivity, as well as COVID negativity. So it was highly sensitive, such that the people who reported COVID symptoms tested positive for COVID 5 to 7 days after reporting the symptoms, and people who did not report the symptoms, it was highly specific for those folks as well. And so this is important because, again, like I said, unless we have a vaccine or treatment, we can only rely on our social mitigation and prevention strategies. And this app can be an important component of prevention for people and for employers to reopen safely. So what does this app look like? On this slide, you see at the very top is the logo for the app. So if you go into the App Store on your iPhone or Google Play, you'll see this logo. You can download the app freely, can we go back to the slide, please? So you can download the app freely on your phone, and what this will allow you to do, it just takes 1 to 3 minutes to complete. I want to also assure, security and privacy are very important for all of us in this day and age. Those of us who do research in this space, we're quite familiar with using sensitive data and protecting sensitive data. And so we are using the highest level of security in terms of this information. The app came actually out of Harvard Medical School and King's College of London, and as I mentioned a few minutes ago, has been disseminated to about 4 million people in both the US and the UK. And what we are doing here in Texas is actually we're disseminating it statewide, because we really want to get ahead of the curve in terms of tracking potential hotspots of COVID. And we are analyzing the data that is coming out of it. And hopefully in the next day or two, actually, we will have a dashboard up on the UTHealth site that will show all of and display all of the data for Texas. As I mentioned a couple of minutes ago, it takes 1 to 3 minutes to complete. It's a screener. So if you, for those of you who've ever taken a screening survey, it asks you about some basic information about yourself, and then it asks you about your potential COVID symptoms. And you can also create a profile for yourself as well as any member of the family. And this is important because you can create a profile for your children, elderly who might not be as technologically savvy, And there is power in numbers. I really want to emphasize that, because we want to identify hotspots, and we want to identify hotspots at the zip code level. So the more representativeness we have at the zip code level, and of course you can then aggregate it up at the county level and so on. But the more people we have, the more accurate we will be in our predictions. And all of those displays will be available freely on the UTHealth dashboard. Next slide, please. So while we're waiting for the slide to come up, I just want to mention that, again, going back to the privacy, the data comes to us de-identified, and so no individuals or individual information will ever be disclosed. It's stored very securely. It's gone through a rigorous institutional review board consent process. And so I think, and myself and my family are recording our own symptoms every day. And what's really nice about the app is not only in regards to the ease of use, but at the end of the app, if any of you have downloaded, you see the proportion who are reporting COVID symptoms in your county. So you don't have to even wait to come to our dashboard to see any of the results. You can actually see the report at the end of the screening every day. So we want, how frequently do we want folks to use the app? We want folks to use the app daily because the symptoms change, and we want everyone to record their symptoms every day, because that we are not just looking at static information, we are looking at changes in pattern of COVID symptoms over time. And that is what can help us predict hotspots of potential COVID activity. From a public health perspective, this is really critical because it also allows us to deploy resources to those areas and such. And then the second important part is we want folks to record even if they are well. We need the right denominator in regards to symptom tracking, because then that allows us to see the shift, right? If, for example, 1,000 people were saying they were well today, but then now tomorrow that has changed to 900, that's the shift that we want to be able to record. And as I mentioned, I've been recording every day for myself and my family, and it literally takes me no more than 60 seconds to do the recording. As I mentioned, we will have the data on the dashboard available granular at the zip code level, all the way up to the city and county level. But this, why is this an important strategy for opening safely? We believe that this is critical for schools and businesses, because if you see an increased activity over time in your zip code of residents or business or where your families are coming from, then you can use this information to plan. This is, you know, we all need a window of planning. We know that, you know, if things cannot change overnight, and that is exactly what this app allows us. It gives us about 5 to 7 days of planning that then we can get things in order, tighten the ship to then employ further mitigation strategies. So in terms of schools, since that's the topic here, you know, Dr. Kelder presented a few weeks ago to Region 10 schools, and there are school districts there who are looking into employing this with their staff, and also sharing and disseminating it with the school families, so that we can, this information can be tracked, especially in the neighborhood schools and such. So there's a lot that can help in terms of the symptom tracking work. And I've added my contact information at the bottom. This whole presentation will be available for folks, and there's more information there on the UT site regarding the COVID tracker, which happy to share more as well. So I'll turn it back to you, Steve, to continue. Thank you.
Hey, great. Thanks, Srila. You know, the moral of the story for the first part of this presentation is that the more data you have, the better your own predictions will be, and the tracker will give you a forewarning of a few days, and that's very helpful. So let's turn to the kids themselves. You know, finding the number of cases of COVID amongst children is not routinely reported. So I'm looking at you're looking at a chart from the CDC that's from February 24th to April 2nd. There's a lot of reports from China, but they're from December and January. So you can see that there's about 2,500 kids, at least on April 2nd. There's an increase that matches what we all experienced in March and in April. I'm sorry, in February and March. To the right, though, is important because the black bars are children. Each bar is divided into different age groups. And the oldest age group on the far right, the black bar, says that even though they tested positive, they did not need to go to the hospital. And that's the largest bar. And that's supporting information of the belief that kids who do get COVID have mild symptoms. We'll talk more about that in a second. Above the black bar is the blue bar, and those are the ones who were hospitalized. That means their symptoms were severe enough to merit going to the hospital. And then the small part on the very top, the light blue, is kids who tested positive, went to the hospital, and ended up in the intensive care unit. In all cases, that's fairly small. So not that many kids go to the intensive care unit as opposed to adults. And those that do go typically have underlying health problems, immune system problems, or other that would explain why, if you add in an inflammation disease, that they get really sick. And then you see on the far left, those are kids under 1 year of age. And they end up going to the hospital at a higher rate, and a slightly higher rate in the neonatal, or I'm sorry, the PICU, the pediatric intensive care unit. Next, please. So let's talk more about that. So children and adolescents, they respond differently to COVID. So as I said, many kids are asymptomatic, about 75% looking at the various places throughout the world. So that's good and bad. It's good because not that many kids are getting it and they don't get that sick. It's bad because you don't know how many kids are walking around your campus. That's why the symptom tracker is important. Kids will be there, but they won't be symptomatic, but they might be positive. So that's troubling. So children who do test positive, as I just said, have a mild form. And again, it's probably because of underlying conditions that have impaired lung function or immunosuppression. So the third point that's important, and data are becoming more clear and are emerging, but it's still a bit controversial, is the child to other, child to child and child to adult transmission. So if you have a child who's COVID positive, what's the chance that they're going to give it to their friends or their siblings or their parents or someone else? And right now it appears as if that rate is well, not well understood, but it's also fairly rare. So why could that be is what I want to talk about for a minute. So kids have smaller lungs, smaller capacity to dispel in droplets the virus itself. Previous vaccines or simultaneous infection with other viruses in the lungs or the mucosa of the airways limits the ability of SARS-CoV-2 to attach to a cell, because the receptors are already occupied either with an antibody or with or an antibody that brings near to the virus or the competing virus, so that the COVID virus, SARS-2 COVID, can't get in. So there's something called angioconverting enzyme 2. So the presence of, and that's common amongst young children. So it's what's called an entry receptor for the SARS-CoV-2 on the actual cell itself. I'm mumbling that. I'm saying that bad. But anyway, the bottom line is, and I'll show you in a second, that because of angiotensin converting enzyme 2, there's a likelihood that children are protected more than adults. Next, The virus is confirmed in feces and in their sputum, although whether or not they have the same viral load as adults is still open to question. We don't know that. If it's lower, then that could be a reason why there's less transmission. If it's equal, then we're still left scratching our head. Soon, answers will be available from Asia and Europe, I think by mid to late June, but that's hard to say. Next. Well, here's just me geeking out a little bit. The bottom line is that youth under than 18 have fewer of these ACE2 receptors for the SARS-CoV-2 virus to attach to. Next. And then here we see a graph that actually displays that. So I'm going to move on a little faster though. Just the lower left side is young kids showing that they have fewer receptors. And there's something new that's out there, and that is what's called what resembles Kawasaki disease, a known disease, and there's a picture of it there, but it's now called multi-system inflammatory syndrome, or MIS in children C. Here I list some of the symptoms of it, and however, it's not very well known at all yet. So it's pretty bad if you get it. But there aren't that many kids that have been reported, so we need to pay attention to that. Next. So after having read a lot of literature and reviewing school plans, I came up with my own thoughts about what will happen if schools reopen. Oops, yeah, I'm sorry, stay closed. So it's important to note that many children, school is the safest place for them to go. It's an unfortunate reality that school teachers and principals know all too well about. There's going to be, if they're closed, there'll be increasing pressure, and it'll probably just need to happen anyway under executive orders. We all know there's a lower quality of education. Digital education isn't suited for economically disadvantaged students, and students may be unable to stay on task for a variety of reasons, or interference at home. So what will happen if schools actually reopen? They'll stop watching TV all day, which is not the best thing in the world for you to do. They'll receive a better quality of education. Their mental health will get better. They'll eat healthier food at school, maybe, likely, healthy breakfast and lunch and snacks. They'll have access to nursing, counseling, and other social services. All the best parts of school will be present, and kids will be able to receive the education and all those wellness and other services. Now, the downside of that is that it might be difficult. It'll be difficult for students to control themselves. I mean, that's the nature of kids. Schools will have a hard time planning. You're probably experiencing all of that difficulty planning because we're still in the middle of trying to figure out the best ways to do it. The students possibly will transmit COVID to themselves and to the teachers, and that will then get transmitted to at-risk parents or grandparents. So that's the bummer downside of this, and why it's hard to do all of it. Next. Just to note that kids are off on their vaccine schedule, so that will be another tricky part for schools to try and handle, is to get them back on schedule so that you don't have other diseases circulating in the school at the same time. We'll probably need help from elected officials in the medical community to help figure that one out. But just to note that there's kids who don't have their vaccines when they should, that are going into school. Next. So this slide is a compilation of different organizations that have proposed strategies to reopen. So I'm not going to go through each and every one. Well, you can't even see it yet, but there we go. Look at these sites. I encourage you to read these reports. Some of them are pretty dense reading, but many of the questions that you have, the answers will be found in those reports, with some with extreme detail about how to go about doing it. So I can't recommend those enough. Next. And yeah, so here's the latest version of the CDC if you go to their website. I'm not going to go through this, but it basically says to follow state and local orders and protect those at high risk and get involved in testing capacity and tracing. Testing and tracing should be a high priority for school people. Next. So I'm going to skip the next several slides and then go to the very last one, please, Kate. Recommendations. So you can read the rest on your own. Those were slides of just some suggested activities, but if you read those reports, you'll find all of those activities in them. Just to finish with, in my own opinion, my own assessment of the situation, I think sometime this summer, where we're approaching into June, that schools should have some kind of pilot test, and maybe what we're doing is what we're calling it summer school. So bringing in a limited number of kids, not all of them, back on campus, so that the personnel there can practice all these new routines, practice getting the right equipment, the right sanitizing agents and masks and all of that stuff, get that in place, find out how to order it and then resupply it. I think that's probably the best thing that schools can do, is to reopen on a limited and very safe basis and practice these things. So with that, I want to pass it to our friends over at Perkins and Wills.
Good afternoon. So I want to talk a little about what are your spatial implications as you go through this. Next. We are at a phase where it would be safe to open schools when we're past the pandemic phase, as Dr. Kelder was pointing, but the numbers are starting to come down. And when they come down and before they stabilize, we will be at a phase where we would have next a series of change that may occur, where the numbers may go back up, may go back down. Next slide. And the next one. So as we look at this, we look at, and the next slide, we look at how we would bring in both promoting healthy lifestyle and practices in the school, but also how would your educational philosophies adapt to this new environment so you can continue the learning and the teaching that needs to occur in a school. We recognize we can't remove all risks. So it starts from the student's home. Is a student living in a dwelling unit which will allow them to have parental supervision should they continue online school? Or would they be in a place where they would not have that parental supervision? A part of schooling outside of just teaching and learning is also providing childcare for the students, because you have students here from the ages of 5 all the way to 18 that spend most of their waking hours at the school environment, giving the parents an opportunity to work outside of home. The second aspect of it is the transit. How are most of your students in your community coming to school? Are they coming by bus? Are they using public transportation? Are they getting dropped off by their parents? Each one of them has a certain amount of risk, and we would like to talk a little more about mitigating some of that as you use your buses to bring your students to school. The third aspect of it to consider is how do students enter your building? So traditionally, in the pre-pandemic phase, we opened only a few doors, maybe 2 or 3, and this allowed us to have secure entrances where students could come in and safely exit. In a post-pandemic world, where you have to reduce the density at any area, at any entry point, could we potentially look at having multiple entrances or scheduling with staggered timings, and each one has implications both on transit, again on that first category of who's taking care of them, who's dropping them, but looking at how would you reduce the density at points of entry in the school, and then through their entire circulation as they are in the school and working around and spending their time in the school. We would also look holistically, next slide, into what would their HVAC constraints be. When I say HVAC, I'm talking about your air quality, like how much air is getting recirculated, what is the type of your type of screening or what type of filters do these air go through. But when you look on an individual basis, you have to also look at some of the behaviors of what would that student be expected to do. And then in a room, you have to look at what are the space constraints and how many people can you have in any space and safely repopulate that space in such a way that they can maintain their 6-foot distance. Next slide. So I would like to get into capacity guidelines. Next slide. So as we look at strategies of how do you safely repopulate their school, we recognize that not all strategies will be feasible for all schools. And as we work across multiple schools across the country, we find that there are different strategies that work for different schools. I will like to address the capacity implications of these social distancing on these 4 areas: the instructional spaces, your bus entry and exit, your administrative spaces, your common areas, and then the electives that may be offered in the school. We think the first phase of what comes back would be your instruction space. And potentially your last area that would come back would be your performance spaces. Performance spaces have the risk of having a large group in a small indoor space tightly packed, and we think that is the last thing that would ever come back into a school as you open it. Next slide. So when we look at instruction spaces, it is important for us to think of what is the actual capacity of your classroom, what would your schedule look like, and what is a shortfall, the people who don't fit in your classroom, how would you still provide instruction for them? And what are the strategies that would allow you to safely repopulate your school? Next. As you look at your classroom capacity and your instruction spaces, next slide. There are 2 ways to look at the bubble. The 3-foot bubble that Dr. Kelder was talking about, it's 3-foot bubble of my bubble and 3-foot bubble from the next person, giving a 6-foot distance between us. If we look at 6-foot distance between people, and do you then consider space for circulation? Do you account for circulation in such a way that the person who's circulating does not interfere within the 3-foot bubble of each other person? So the next slide. And as you look at returning back to school, the sketch that you see on the left-hand side that says pre-pandemic is a typical classroom that we see across the United States. Now, some of your older buildings may have much smaller classrooms than some of the newer buildings that may have larger classrooms. This is relatively easy for you to accomplish by your maintenance or your facilities people as they walk through the campus and spread the people out. But the considerations that you might have to take into account is, do you spread them out such that each student is outside of the 6-foot bubble of the neighboring student? Or is each student sitting in such a way that they have circulation space that is also outside of another student's 6-foot bubble? And both of them have space implications. But the really big question to ask here is, what happens to the remaining students? So if a teacher is used to teaching 28 students in a period and instead has only 9 or 15 students in the classroom, how do we accommodate the rest of the students? So the other aspect to look at is, what age group are we looking at? The younger group it might be easier to monitor the older groups compared to the younger group. So you might look at a smaller population coming back into the classrooms or using larger classrooms to accommodate these programs in a younger generation. And as they move into high school or older group, you could always look at providing a hybrid model where a part of the students are in the classroom and part of them are logging in either from their homes or another place where they can safely interact with other students but are not physically present in the classroom. The hybrid model doesn't work really well for younger class students, but can be implemented at a high school level, much like colleges are looking at doing a hybrid model for their college classes. Next. Some of this reduction in density will also impact how much capacity your corridor or reduction of density in your corridor would get affected. But some of the elements to consider is disinfecting student desks before and after each use, but who disinfects it? Is it a maintenance staff that helps them? Are you relying on the students to do it? Or is it the teachers who would work on disinfecting the desks between each class period? And what is the time that it would take to disinfect an entire class before the next set of students come in? Next. And we would recommend discontinuing uses of areas which would create crowds traditionally in a school, such as a locker space, and ensuring, next slide, ensuring that we have sanitation stations throughout and providing graphics and other ways of implementing new behaviors in the students. In some cases, next slide, you could create visual cues across so that students remember to maintain distance as they walk in the corridors. One of the challenges as we speak with different school districts, what we find is it's less challenging to reduce the density in the classroom, but it is a higher challenge to reduce the density actually in the corridors as students change classes and come in or exit the school. So we are working with some school districts to figure out strategies on how we can accomplish reduced density and create a flow pattern so that will allow them to safely bring the students, take them through their school, and have them exit without getting in close proximity with the rest of the school. These are some images of what has been implemented in some other places, whether it is in Germany, where they have either done alternate desks to occupy it, or in China, where they have designed some fancy hats so students understand what that 6-foot distance is and they're not always in each other's space. But as it gets safe to repopulate the schools and bring the students back, one way to also look at is using technology to create more immersive environments so students can still continue to experience the outer world and the other areas and continue their learning. Next slide. I will pass it on to Angela to talk about building entry and the other two aspects of school.
Okay, so we talked earlier a little bit about bus capacity, and we know that transportation is a major challenge for all school districts. Your standard bus will hold 71 students packed shoulder to shoulder, and that's no longer possible. So really have to think about the spacing within your transportation and how that affects also the number of the way you load and unload the bus, so that you're maintaining that 6-foot distance at your bus stops, and as you unload the bus, giving staged and scheduled loading and unloading times, perhaps at those multiple entries like Vandana mentioned, to reduce the density of loading and unloading. Next slide. We would also consider students wearing masks on the bus. As we enter the building entry may need to be thinking a little bit more like some of the other building typologies than K-12. It's possible, rather than having parents come sit in a waiting room waiting for that meeting with the teacher, waiting to pick up their student, that maybe there's a cell phone lot and they call the front desk and wait for little Johnny in the lot, and they get checked out digitally online, so that you can keep that free space in your reception area for people to circulate, ask a question, and leave, rather than hang out for extended periods of time, increasing exposure. Also considering where the sanitation station might be as you enter, and how you still maintain that secure entry and do the best to protect that person working your front desk from the multiple people they're exposed to daily. Next slide. We have also been working on multiple strategies for workplace, and I think some of those strategies also can translate to K-12. As Dr. Kelder was talking about, maybe it's a phased return. Maybe you can't take a full capacity based on the demographic of your city right now and the number of people that are infected. So it may be a phased return or a partial return, and you gradually allow more and more students in as the cities begin to recover. but also you'll have to look at multiple protocols across almost every service that's provided in the school district, from how you commute to how you clean all of your equipment to how you handle food and beverage. You know, lighting students up on a cafeteria tray and having one person serve them food all day may not be the best thing. Thinking about packaged food, disposable, not handling dirty food plates. I think there's lots of options. And how you handle deliveries and even maintenance. All these protocols need to be designed working within the COVID strategies that we've been discussing. Next slide. Some of these are really difficult behaviors to manage and will become quite a burden on people thinking about them all the time, but I think that there's ways to implement them simply. Next slide. When we think about our administrative spaces, even some of your offices where you're used to having small group meetings, may not even hold anyone other than the occupant of that office. So you may need to think about, do your meetings stay online when you're meeting with parents or faculty, or do you move to even larger offices or larger conference rooms? Next slide. So that you can maintain your 6-foot distance from each person, and your small meeting may become in the larger conference room that you're probably fairly short on in most school districts. Next slide. We often use these conference rooms and have tape or remove the chairs from the room so that you can reduce the number of people in there simply. And then the cafeteria poses another challenge, as Dr. Kelder mentioned the notion of super spreader spaces. That if we don't think carefully about the cafeteria, it could be one of those places where you have lots of people who can't wear masks because they're eating and drinking in close proximity and moving in and out. So one of the strategies could be to limit the number of students allowed to use the cafeteria, eat in your classroom, have individual wrapped portions that are distributed by cart so that no one's going through the same line all day and you're reducing that. And that may even give you the opportunity to use your cafeteria for more learning space to give you that elbow room you need when you run short of classrooms. Next slide. The cafeteria also has to be focused on sanitizing and hand washing prior to eating, because that's another prime way of putting things in and out of your mouth after you've touched things. So looking at your cafeteria, just the sheer occupancy, when we line up those tables and we're running 100% occupancy, by the time you add social distancing, you're really only getting close to 25% occupancy of that cafeteria. So could it be put to use at a higher purpose? Or do you have 25% of your population that really need to eat in the cafeteria for a specific reason? And those are things that need to be considered. Next slide. And the last thing we're going to kind of talk about is the gymnasium. You know, in the midst of the world where we're asking students to all stay far away and limit our movement past one another, movement is incredibly important to students for their both physical and mental health. So really strategizing ways that we can continue to implement physical education and really think about what does that heavier movement mean in terms of distance between students, or possibly converting the gym to classroom space and pushing a lot of work outdoors, depending on what you're doing. We have Ms. Green with Catch who'll go into deeper on how to implement athletic and physical education into your COVID plans. Next slide. The next slide. And I think the next piece that's really important is making sure that those messages and whatever strategies you put in place are really clear and easy to follow. So putting in graphics or approaches, reminders for everyone continually, because this is all new behaviors that students will be learning and faculty will be learning. So keeping those graphics up, or marking the floor, or marking the seat, marking the table, don't sit here, sit there, are really good reminders to do it without having to say it all the time. Next. And even reminders on the floor using graphics to separate your lane, to move people, or to delineate the way you're going to organize a room. A little bit of painter's tape goes a long way. Next. And with this, I'll pass it over to Ms. Green for Catch.
All right, thank you so much, Angela. In the short time that we have to discuss health and PE, we can't possibly cover the litany of issues that need to be addressed. But if we approach this topic with the lens of the whole child approach, we can direct the things that we do moving forward. And in doing so, we can address many of the stark issues and challenges that have been brought to the forefront during this time, such as inequities in education, access to technology, food and home insecurities, among others. When discussing plans for the fall and reopening, we keep hearing from education leaders that ensuring the health and safety of students, teachers, and staff is of the utmost importance. It's important to note that when we say and hear health, that doesn't just mean free of illness or not sick. It means addressing all aspects of health, including physical, mental, social, and emotional health. Health is not just a class or a one-time lesson. To be transformative, health must be part of the school's culture and interwoven into everyday routines. This is especially important this year. We need to meet our students where they are and offer practical and supportive ways for them to re-socialize. Catch Global Foundation does an excellent job guiding school personnel in the process of creating healthy environments using coordinated efforts. And we'll share some of that with you today. I love this quote from Rahm Emanuel. Never let a good crisis go to waste. It's an important opportunity to do the things that you once thought were impossible. Educators are among the most resourceful professionals, and they have shown that to be true during this pandemic. In a matter of weeks, teachers all over the world have pivoted to a distance learning model, a feat that we once thought was impossible. Our educators didn't throw up their hands, they didn't give up. They did whatever they needed to do to reach, connect with, and teach their students. Similarly, we've been able to highlight the importance of health and wellness in the home and connect families and educators to resources. So from a health and wellness perspective, let's take a look at some of the opportunities that we have moving forward. We have an opportunity to really connect all aspects of health, such as immune health, emotional health, and mental health to student learning. The things that will be critical in the fall include addressing the social and emotional wellness of not just our students, but also the faculty and staff. All of us have been facing extreme challenges and situations. Valuing connectedness and using a whole child wellness approach will help everyone, especially our most vulnerable students. Our health and physical educators are well positioned to be important leaders in this effort because they already address health and they routinely teach and reinforce social and emotional learning. This is an opportunity for our health and physical educators to really lean into the role of wellness leader or champion. The role of a school wellness leader is to lead a wellness team that is comprised of classroom teachers, administrators, maybe your counselor, nurse, cafeteria staff, librarian, in efforts that make the campus healthier and in doing so, happier. A wellness team can effectively help everyone navigate a new normal. Finally, we truly have the opportunity to engage with parents and to promote health and wellness in the home environment like never before. Next slide, please. Over the summer and into the fall, schools and districts are going to be looking at their very tight budgets, and in some cases, there may be an unimaginable reduction of resources. Now is the time to advocate for health and physical education like never before. As we all have spent the last few months under shelter in place, the importance of mental health and self-care have become apparent. One way to address both is through movement. It will be important that students have multiple opportunities to move throughout the school day. This could include activity breaks in the classroom, recess, and physical education. Lessons and short activities that help with mindfulness and stress management are important things to integrate as well, whether at school or at home. We also learned a lot about the importance of a healthy immune system to fight off illness. Experts everywhere have been stressing the importance of being physically active, eating healthy, and engaging healthy habits and hygiene practices. In the fall, even more time should be given to teaching and reinforcing these lessons. Next slide, please. Given the expertise and guidance the other presenters on this webinar have just provided, we are likely to see several scenarios play out in the fall, such as in-school and in-person instruction, distance or virtual learning, or a combination of the two. As such, planning ahead will be crucial to ensure continuity of learning such that key concepts and skills are taught during in-person time and practiced and reinforced at home. Before we get into a few examples of what PE might look like in schools as we reopen, I want to emphasize that physical educators offer valuable expertise and skills that will be important at the start of the school, especially teaching and practicing new routines for physical distancing. Health and physical educators are skilled in moving and managing groups of children in an organized and safe manner, which is important in order to maintain physical distancing, minimize risk, not just in PE, but throughout the school. Next slide, please. While we can't provide specifics or solutions for every scenario, we can talk about what students are going to need and talk about specific instructional goals that can cut across all of these different scenarios. One thing PE teachers can do is modify their curriculum to emphasize basic skills, skill remediation, and focus on fitness. In particular, PE teachers can emphasize the parts of the curriculum that can be most useful to students right now and give them the skills, knowledge, and confidence to keep moving and being active in school and in social distance settings. We can focus in on teaching students skills that will enable them to be independently active and give them the motivation to be active for a lifetime. In addition, kids and adults alike will need healthy strategies to cope with stress and trauma from this unprecedented and ongoing time of challenge. Addressing what students need now can and should be the driving force of instruction across all of the different possible scenarios. Next slide, please. First, let's address some different possibilities of where PE instruction and physical activity can happen while maintaining social distancing and minimizing risk. Teaching outdoors will be a key instructional area where feasible, because physical distancing is even more important when kids are breathing heavy. In many cases, outdoor venues present an opportunity for increased physical distancing and minimal risk for virus transmission. Teachers can also deliver PE instruction in a classroom setting or other small spaces. It's important that in these smaller spaces, activity is kept at a moderate level instead of vigorous, so that students are not breathing too heavy in a confined space. Try to be creative with scheduling so that the same class of students can work with a PE teacher for a set number of days before rotating to art or music or another discipline, minimizing the number of students in PE at one time and keeping the class together. In-person PE will also require reduced class sizes, minimizing equipment, establishing clear entry and exit procedures, and including a hand washing or hand sanitizing, among other things. Given the challenge that will present in the fall for teaching PE, emphasizing fun and enjoyment of being active and foundational movement concepts and skills will be very important. Next slide, please. Preparation and provision must be made for both virtual instruction as well as hard copy packets to those without internet access. Additionally, it will be extremely helpful for parents and students if schools and teachers coordinate prior to the start of school to streamline their distance learning approach. For example, use 1 or 2 primary platforms to push out all content. PE teachers should collaborate and be included in grade level team planning to make sure that PE and health content is incorporated as seamlessly as possible. Looking specifically at PE in a virtual situation, the focus will be on practicing and reinforcing concepts and skills that were previously taught during in-person instruction. At-home learning will need to be modified to accommodate for lack of space and limited or modified or even no equipment. Offering choice and variety in home activities will be critical. Next slide, please. In a hybrid scenario, in the event that schools use a combination of the in-person and distance learning, schools and teachers will have to consider all of the points from the in-person scenario as well as the distance learning scenario. In a hybrid situation, in-person instruction should focus on introducing and teaching key concepts and skills. Teachers should provide instructions for students to practice and refine those skills when they're at home. It's also important to note that students will miss connection when they're at home, and live activity lessons or recorded videos will help ease that sense of loss. We still want to encourage students to be physically active for 60 minutes each day, The use of challenges and calendars can make this easy and fun for students as well as their families. Next slide, please. In some situations, it may be necessary to redefine roles and responsibilities of your faculty. It's important to keep in mind the strengths that lie within your health and physical educators. They not only play an important part in helping students understand the importance of health and physical activity, they are also in a position to influence the attitudes and values of kids and families. Therefore, they will be critical as wellness champions on their campus and in the virtual education setting. Other wellness team members also play an important role in sending health messages home and teaching health when students are on campus. The picture on the slide shows one of our Catch champions from Chicago Public Schools, who recorded weekly videos of herself delivering Catch MVP messages to share health promotion tips and incentives with her school community during school closures. This is an excellent example of the new and creative ways that health and PE teachers will be able to reach students, families, and their entire community. In addition to what they do during their instruction time, health and physical educators can also be instrumental in empowering classroom teachers to incorporate meaningful movement experiences during their instruction, whether that be in person or in distance learning. Since PE and recess time will likely be limited in time and/or space, incorporating movement opportunities throughout the school day and in the classroom will be crucial. As leaders of campus wellness teams, health and PE teachers can introduce and promote a common language that is taught across the campus and at home. Wellness teams can be functional in the virtual world as well by using the same language and creating family and community health challenges, teaching and reinforcing health behaviors, and so on. Next slide, please. Catch Global Foundation has worked, like so many others, to curate and offer resources to educators and parents during this time. In addition to the full complement of Catch curriculum and resources, we've also developed Catch Health at Home platforms for both parents and educators, which are available at no cost. The resources not only focus on health education and physical activity, but address numerous other areas, including mindfulness and stress management, health behaviors to support immune system, and practices such as hand washing. Additionally, we are currently developing training modules that will assist health and physical educators to navigate whatever educational scenario they may be facing in the fall, whether that's in person, distance learning, or the hybrid of both. Next slide, please. To wrap up, we realize that there is still uncertainty about how and when we go back to school. We are constantly learning new things about this situation and growing our resources to meet the needs of our schools, districts, and educators. One thing we know is true is that we need to invest in the teachers and the environments that we want to have for our students. Like Dr. Kelder mentioned at the beginning of this presentation, we have to do what is best for our children, and keeping the whole child tenets of students being healthy, safe, engaged, supported, and challenged is the best way to do that. Catch will be here with you every step of the way to offer guidance as schools make plans and decisions about reopening using guidance from the CDC as well as Shape America. We've also partnered with Action for Healthy Kids to offer Catch Whole Child implementation through their Game On grant platform. The training and support model will be developed completely remotely and would operate like a professional learning community. There is no need to convene in person. If you're interested in learning more, please visit us at catchinfo.org/grantfinder or send us an email at info@catch.org. Thank you so much.
All right, well, thank you so much. I would like to invite all of our panelists back here. We're thankful. Thank you so much for great presentations. I think we were a little ambitious to try to get all of this information crammed into such a short time period. And I appreciate the understanding from our attendees that we aren't going to be able to answer all of your questions on the live webinar, but we have captured all of your questions, and we are going to kind of look at those, compile them, possibly make some kind of FAQ or just a summary of answers to everyone's questions, because a lot of you have the same questions, and we will get that out to you as well in some kind of form or another. So keep an eye out for that. Not surprising when we have thousands of people on here that we have hundreds of questions to look at. So I'm going to try to keep things a little higher level so that we can kind of answer some of the broader themes that came up in the questions here. But I do want to start with some people that have written in and said things like, it's one thing to lay this out on paper, but in reality, will this work? People have brought up South Korea as, kind of being ahead of where we are with testing and ahead of us on some of these protocols, and yet we saw that they opened and then quickly had to reclose. And some people, even writing some comments that seemed very despondent in the sense of this seems logistically and financially impossible. So again, I do want to preface before I ask our panelists to kind of respond to this, but when we were doing our planning calls, we hope we aren't leaving you feeling hopeless, but we knew that we weren't going to have all the answers. There's so many variables and so many of them are in constant flux that what we really wanted to focus on is helping people understand what are some of the good questions to ask and to understand that this is a very complex decision that's going to be made. It is not a gut feel of, I think we should open. Dr. Kelder went into the science of the virus and Dr. Sharma on tracking. The folks at Perkins Will went into, well, what are the spatial implications? And then, at Catch, we were talking about what are the, kind of pedagogical and student interaction, implications as well. So we hope that we've given you some idea about the right questions. And so one of the first things that did come up, though, was we talked a lot about students. A lot of people on here are teachers and other people working in schools. So what are things that we can say to adults who feel more vulnerable than kids to make them confident in reopening schools, whether they're in the schools themselves or if they're worried about kids being vectors for bringing it back home? And I'll start with Dr. Kelder at UT, and then we'll go to Perkins and Will, and then over to Shana.
Sure, thanks, Brooks. I think the thing that teachers or staff on campus need to pay attention to is looking at those risk factors that are known to place people at higher risk. And certainly one key one is age. So, I'm poking it at 62, the age range, and I've had some respiratory issues in the past. So before I go back to work in the fall, which I will, I want to visit my doctor and find out, how do they think the risk level is for me personally. It's kind of hard to say without having a bit more professional advice in that way. But certainly, if you have a history of respiratory issues, if you're immunocompromised, then you probably are at higher risk. You can also check the sites that I told you about to find out what your county level prevalence is. And then, as Shrila said, the symptom tracker. So better understanding of how bad it is in your situation is the right way to go. Better understanding about you personally with your physician is a good thing to do. And then if you are deemed at higher risk, you may, you probably need to talk to your principal about differential duties which will place you in a safer place, yet still maintaining your productivity. That's what I would think.
I'd like to add to what Dr. Kelder said. So we're focusing not just on the students, but also on the faculty, the staff, the teachers who would have multiple contacts. So if you are teaching 6 or 7 sections in a day, in the pre-pandemic world, you probably were coming across 150 to maybe 300 students in a day, every day. And you really don't know the choices they have made prior to coming to the classroom or the choices they'll make after they have left you in the classroom or their family members. So one of the propositions of when we were talking about a hybrid classroom to allow for students, some of the students to log in, and I didn't go into greater detail on that. One of the ideas over there was also to allow the faculty to log in or the teacher to log in. So you have multiple screens. You allow for the students to actually see the faculty in person. It depends on how high a risk category you might be because of your pre-existing condition, or also how tolerant you would be to the risk of exposing yourself to the students. So all of those factors would be different, but giving choice both to the students and the faculty, where they have a choice to either virtually engage with their students at certain scheduled time, or they would in person engage with the students, is going to be very critical.
Brooks, can I add one thing? This is Srila. I really like what you said, Vandana. You know, as faculty at a university, we are dealing with the same issues because we have to also teach in the fall. And so we are working through a lot of these issues ourselves, and you know, having a menu of different options that are viable is sort of the direction that we're taking. And I also think it's important for folks who are tuned into the webinar to know that we are a resource. You know, all the panelists here are a resource. UTHealth is certainly a resource, and many school districts are putting together task forces and such, which is great. But so ensuring that, you know, you're utilizing the resources and the expertise that's already there in the community, so you don't have to recreate the wheel. And we can share best practices and solutions because there's the recommendations, but then putting them into practice is a whole different ballgame. And so I think the more we can share with each other, I would welcome folks to reach out to any of us as a resource. We are here to help.
Yeah, thanks so much, Srila. That's really good to know. And I want to ask Shana, you used to be a campus wellness leader, a CATCH champion. What would you say to the teachers, the administrators, the parents to kind of help them feel a little more at ease about you know, coming back to school?
I would say self-care is key. You know, just being a teacher, I know that, and a parent, like, you're always putting other people before yourself. And so really taking care of yourself, you know, doing those healthy habits, getting enough sleep, building your own immune system, being mindful of how you feel when you go to the classroom. I think all of those things will be key after you've done, you know, you've visited your doctor and you've really decided that you're ready to go in person. Then just keeping that at the forefront, you know, taking care of yourself each and every day is going to be very, very important.
Great. So I want to ask about one population that I don't know that we directly address, but is obviously, you know, seems like a very central figure, is school nurses, and kind of the spaces. You know, I think we've got several nurses on the call here because some have asked, you know, mentioned specifically that their school nursing station doesn't have, you know, windows even. So what are considerations around, you know, kind of both maybe keeping school nurses safe, but also, you know, that being the space where you send sick kids. What are some of the kind of considerations and implications? Should they move that space? Should you know, how should that take place? And let's start with Perkins and Will about that, if you've considered the built environment at all.
We actually did a survey of some of our clients to see how many of them actually have a full-time nurse and what are some of the resources that they currently have. And what we found, which was very interesting, is not all schools have full-time nurses. So that's going to be a consideration for schools when they open up. Some of them have part-time nurses. Some actually have a nurse who covers multiple schools and is at that campus only one day a week. So it's something to think of as you reopen the schools, is your access to nurse and your availability of nurse on your campus. The second aspect is in a school, students don't just come to the nurse when they are not well or when they're unwell. They might come there to pick up their daily meds. They may come there because they have scraped a knee. They may come there because they just don't feel great in their stomach, or they may come there because they're actually sick. So we do think that separation of those activities is probably important. I think we spoke a little about creating self-quarantine areas, you know, where you can hold a student. Say the parent drops a student and drives away, but then you discover that this child is sick or is having fever or any of the COVID-19 symptoms. Where would you actually isolate that student? You probably want them to be in a place that is separate than where you would actually have students come in because they have a scraped knee. Angela, do you have something to add to it?
The other thing that I would add is that nurses need to have the appropriate degree of PPE and also have procedures for cleaning all of these spaces in place. They probably already do some of that, but to the degree of COVID, maybe not quite yet. And really communicating some of those procedures out to the faculty broadly, so that if the faculty realize someone is sick, that goes from the classroom all the way to the nurse in that circulation spine, that thought of protection, that you don't send the sick kid down the hallway during a passing period. Those type of things need to go into that strategy.
Yeah, excellent point on that one for sure. And so I see that we're basically out of time. So I want to ask one kind of final question to the group, and try to keep your answer brief because we want to respect folks' time. But as districts and campuses assemble kind of their decision-making teams and start kind of coming up with their strategy for reopening, who is someone, or maybe a couple people that they may not be thinking of, who should be perhaps on that team or involved in that decision-making process, and how might they engage them? And we'll start with UT, move over to Perkins and Will, and Shana, we'll have you come in last.
Well, I think if you look at the CDC and their WISC model, they've identified all the people at a campus that have a role to play in school health. And one that we haven't talked much about is counseling staff in the role that they could play. And food service staff clearly have a lot to say about this. And then outside the school, parent volunteers or other community volunteers. I think everyone's going to be short-staffed as we reopen the schools because things are different. The nurse might need additional support in addition to reserve space for kids who are sick, especially with COVID or other infectious diseases. So that would be my recommendation.
I can go next here. As we look at that school population, the people who come to your school is a reflection of your community. So as we open the schools in fall and bring students back, I see a lot of discussions among school districts that is happening, or even on a higher education campus, that is happening with task forces and conversations of how do we get learning to occur. But I don't see as much outreach back to the community to say, what are you thinking as a parent? Are you comfortable with some of this? So I think that's a missing component we see. We encourage, as we work with our school districts, to say, let us start reaching out with surveys to understand what is your community thinking? What are some of the ways that they want to be engaged back? And how would they feel safe sending the students back? So it's one thing to work on all of these aspects, but it's also really important to understand your community's mindset.
Great, and Shana will give you the last word on this one.
I would add the school nurse for sure, and physical educators or some type of wellness leader, so that you can follow that CDC WISC model and really have a team that is all focused on health on your campus.
Fantastic.
All right.
Well, we are out of time, unfortunately, so I'm going to have to kind of end us here, but we have a lot of great questions. I was already categorizing them all, and then, I'm sorry I couldn't get to more of our attendees' questions, but please know we are going to take a look at those. We're going to get some answers out to you. There are a lot of questions to respond to, so give us a little bit of time. But what we will get to you quickly is the recording of this webinar, the PDF of the presentation slides. We mentioned a lot of resources, a lot of links, a lot of homework and reading for you all. So we'll get that to you right away. And you've got contact information on the screen. So if you have specific requests for one of our specific panelists, please do reach out. Thank you very, very much to all of our panelists for your participation and all your time to these talks. I really think that it was valuable, and I really appreciate all that you're doing, not just saying, but these are people who are doing it. So thank you very much. Thank you to everyone who attended. Thank you to Michael and Susan Dell Center for Healthy Living for hosting this great webinar and making this all possible. We hope you all stay safe out there and stay well. And we look forward to continuing this conversation. I think you may see an announcement from us for some follow-up sessions and some other topics and areas, especially as some of those variables come more into focus, as I mentioned. So thank you all very much. Have a wonderful afternoon and take care. Bye-bye.
Bye.